You ask, we answer. To continue our discussion on COVID-19, Dr. David Banach joins us from UConn Health.
Dr. Banach, thanks for joining us here.
Thanks for having me on.
So now that the Omicron variant is literally on our doorstep, it's been detected in New York State, several cases. How does that change our course of action here in Connecticut? Did this, in your opinion, from what you're seeing, speed up what we need to be doing to increase immunizations and try to protect us against this variant? Well, how does this change?
So, I think there is still a lot to learn about this variant. It does seem to be more contagious, seems to spread a little bit more quickly from what we're seeing that's occurred in South Africa. I think, in terms of the messaging, I think we still need to be aware of what's happening, be cautious, and certainly, do all the preventive measures we need to be doing to prevent infection. So vaccinations, particularly boosters, are going to be important. I think, we're still learning more about the impact of boosters with regard to this variant, but there is suspicion that the boosters will provide some protection. And that's going to be really important, if we start to see this variant become predominant. But it's also important for everyone to know that right here in Connecticut right now, Delta variant is still the predominant variant. I mean, we know the vaccines are effective against it. So I think all the more reason to go out, make sure you're vaccinated and go ahead and get that booster when you're eligible.
I mean, we know that the Omicron variant is in New York City. We know it's, in different parts of the United States. Do we have the testing capability here to detect that at this point? And what's the possibility that it's probably already in Connecticut?
So that's a really important question. I think it's important for people to know that here in Connecticut, we have a very robust genomics surveillance program. So there's multiple labs in the state that are able to do genomic sequencing, which is what's needed to classify variants, including identifying the Omicron variant. So, I think we do have the laboratory capacity. We're sequencing a large percentage of our isolates. And I think that's going to be really important here in Connecticut to be able to identify the variant and understand what kind of measures need to be taken. But it's still important to know that at this point, the Delta variant seems to be predominant.
Okay, so Delta variant's predominant, but we're heading into the winter time. It's getting colder outside. People are spending more time inside. If you're vaccinated and you're getting your booster shot and you're doing what the CDC and FDA recommend right now, then you're probably, what you're saying, is in good shape, even if the Omicron variant does show up in Connecticut. But for those that are unvaccinated, haven't gotten a booster shot yet, or maybe even haven't gotten their vaccine yet, and they're spending time inside without a mask, how does this change things going forward as more people are spending more time inside if this variant's already in Connecticut? We're seeing studies that it's more contagious already than Delta.
Yeah, no, I think, that's, you're bringing up a lot of great points. I think we know this variant, this Omicron variant is more contagious, and it does seem to be extremely contagious among unvaccinated individuals. So, I think, the vaccines are protective against Delta. They do prevent the spread of Delta. And there's a good expectation that they'll provide some protection against this Omicron variant. So, when you're looking at gatherings, trying to ensure that as many people in the gathering are vaccinated, ideally everyone in the gathering would be vaccinated. And then if there are people who are unvaccinated, taking that added layer of precaution, like wearing masks, particularly if there's people who are particularly vulnerable, immunocompromising conditions, other high-risk medical conditions, using that extra layer of wearing a mask is important in trying to prevent spread. So, be mindful of what's happening, and, the vaccinations are still really critical, including boosters.
Yeah, and just a reminder, too, I know I was scheduling my booster shot, and, they're jam-packed right now. There's appointments like a week or two out, but as the holiday season continues, those will fill up. So if you're looking to get it, don't wait if you're trying to get it before the Christmas holiday, that's for sure. Dr. David Banach, thank you very much.
Thanks, Dr. Banach.
Thanks,